You know, I'm all about helping you feel confident and comfortable in your own skin, and that's why today we're tackling a common skin condition that affects so many people: eczema. Eczema can show up in so many different ways, which can be super confusing when you're trying to figure out what's going on. That's why we're breaking down the 7 most common types of eczema, from the causes and symptoms to the best treatment options out there. We'll cover everything from those itchy patches of atopic dermatitis to the frustrating blisters of dyshidrotic eczema. Knowledge is power, right? So let's get you familiar with these different types so you can take control of your skin health. Eczema is a common skin condition that affects millions of people worldwide. Today we're diving into the 7 different types of eczema, their causes, symptoms and treatments, and how you can manage living with eczema. Let's get started.
First up, let's talk about atopic dermatitis, the most common type of eczema. Now, this one often starts in childhood, and you might hear people calling it infantile eczema. It's a chronic condition that makes your skin itchy, red, and inflamed. So what causes it? Well, it's a bit of a mystery, but we do know that genetics play a role. If you have a family history of eczema, asthma, or hay fever, you might be more prone to it. Basically, your immune system overreacts to certain triggers like dust mites, pollen, or even certain foods. The good news? Atopic dermatitis can be managed. Moisturizing daily is key to keeping those flare-ups at bay. And if things get really itchy and inflamed, your doctor might prescribe a topical corticosteroid cream to calm things down.
Next, we've got contact dermatitis. This one's all about direct contact with an irritant or allergen. We're talking about things like soaps, detergents, fragrances, poison ivy, even certain metals like nickel. Now, there are 2 types of contact dermatitis: irritant and allergic. Irritant contact dermatitis is like a direct injury to your skin, while allergic contact dermatitis involves your immune system having a bit of an overreaction. The key to tackling contact dermatitis is pretty straightforward. Avoid the culprit. I know, easier said than done, but once you pinpoint what's triggering your skin, you can take steps to avoid it. And of course, your doctor might recommend over-the-counter or prescription-strength creams to soothe those itchy, irritated patches.
Let's talk about dyshidrotic eczema. This type is characterized by these tiny, itchy blisters that pop up on your hands and feet. I know, not fun. It can be super uncomfortable and even painful at times. The exact cause of dyshidrotic eczema is still a bit of a head-scratcher, but we know it's often linked to stress, allergies, or even exposure to certain metals like nickel or cobalt. When it comes to treatment, cold compresses can be your best friend to help soothe the itch and inflammation. Your doctor might also prescribe a corticosteroid cream or ointment to help those blisters heal faster. And if you're dealing with frequent flare-ups, they might suggest other treatments like UV light therapy.
Chapter 4. Neurodermatitis, the itch that won't quit. Now, neurodermatitis, this one's all about the itch. It starts with an itch that you just can't help but scratch, and that scratching actually makes it worse, leading to thick, scaly patches on your skin. It's like a vicious cycle. Stress is a major trigger for neurodermatitis, but things like insect bites or even just having dry skin can also set it off. Treatment for neurodermatitis focuses on breaking that itch-scratch cycle. Your doctor might recommend anti-itch creams, topical corticosteroids to reduce inflammation, or even things like antidepressants to help manage the underlying stress that could be contributing to those flare-ups.
Chapter 5, Nummular eczema, the coin-shaped culprit. Nummular eczema, ever noticed round coin-shaped spots on your skin? Yeah, that's this type of eczema. They can be itchy, dry and scaly, and sometimes even ooze or crust over. Dry skin is a major culprit behind nummular eczema, but things like skin injuries, insect bites, or even contact with irritants can also play a role. Moisturizing is key with nummular eczema, just like with other types. But your doctor might also prescribe corticosteroids to calm the inflammation, or even antibiotics if those spots get infected. It's important to treat this one early to prevent those spots from spreading or becoming more severe. Chapter 6. Seborrheic dermatitis, the scalp and face struggle. Let's talk about seborrheic dermatitis. This type loves to hang out on your scalp, face and other oily areas of your body. You might notice flaky, greasy scales that look a bit like dandruff. The culprit behind seborrheic dermatitis is actually an overgrowth of a yeast called Malassezia, which, believe it or not, naturally lives on your skin. But sometimes it can get a little out of hand. The good news is that there are specific shampoos, conditioners and creams designed to control that yeast overgrowth and keep those flakes at bay. Your doctor might also recommend topical antifungals or corticosteroids depending on the severity of your symptoms. Chapter 7. Stasis dermatitis. More than just a circulation issue. Last but not least, we have stasis dermatitis. This one often affects the lower legs and is linked to poor circulation. You might notice swelling, redness, itchiness, and even pain in the affected area. Stasis dermatitis happens when your veins have trouble sending blood back up to your heart, causing fluid to leak out into your skin. This can lead to those uncomfortable symptoms and even increase your risk of infections. Compression stockings are key for stasis dermatitis. They help improve blood flow and reduce swelling. Your doctor might also prescribe topical corticosteroids to calm inflammation or even diuretics to help get rid of excess fluid in your body.
So, there you have it. The 7 most common types of eczema. Remember, eczema is a very personal condition, and what works for one person might not work for another. It's all about finding what works best for you and your skin. If you're dealing with any type of eczema, don't hesitate to reach out to a dermatologist or healthcare provider. They can help you figure out the best course of treatment and provide personalized advice. And remember, you're not alone in this. Millions of people around the world are dealing with eczema, and there are tons of resources and support groups available. Living with eczema can be challenging, but understanding the different types and their treatments can make a big difference. If you experience severe symptoms or your eczema isn't improving with over-the-counter treatments, it's important to see a doctor. Thanks for watching, and don't forget to like and subscribe for more health tips.